Welcome to Adapt NCLEX. NCLEX love health promotion on pregnancy, and therefore we're going to talk about anticipatory guidelines, things the pregnancy lady to know, in addition to safety of a nurse who is taking care of this patient if they are also pregnant, all in the form of select or apply. Are you ready for SATA 10 questions on anticipatory guidelines regarding pregnancy? Buckle up. Let's go. As usual, every question, you stop the video, you try to attempt to answer the question on your own, and I will give you the key fact. I will highlight the information that you need to know, and then you keep your score. And you put your score at the end of the video and let me know. What do you think? It's a select or apply, SATA question, health promotion, pregnancy question, anticipatory guidelines. What do you know? How do you approach it? Read it from the back. What do you see? Select or apply. That means all these questions, answers, you don't need to pick everything 100% confident before you pick it. Then go for the buzzword. Which situation should the nurse instruct the client to what? Avoid or report. That means it's not good during pregnancy. And nurse is teaching a client who is what? 8 weeks pregnancy about workplace safety. That means this lady patient is a nurse who is pregnant, and therefore you're giving them workplace safety. Provide care for a client who has active cytomegalovirus infection. Provide care for a client with active cytomegalovirus infection is the appropriate for this pregnant nurse. Performing routine care for a client on airborne precaution with tuberculosis. Handling what? Chemical agents. Administering what? Live vaccine to pediatric clients. Exposing to what? Ionizing radiation without protective shield. Caring for clients in what? Neutropenic precaution. Providing care to a client on what? Contact precaution. You see the way I approach the question and answers are underlying the keywords that should trigger something in my head. What do you think? Pick your answer choice. Let me know. Put it down in the comments. And the last one, caring for a client with what? Parvovirus B19. These are all the questions you've been given. Did you pick your answer? I know there's a lot of them. Patient with what? Cytomegalovirus. Patient on airborne precaution with tuberculosis. Patient nurse has to handle chemical agent. Give what? Live vaccine to pediatric patient. Ionizing radiation without protective shield. Neutropenic precaution. Contact precaution. And Parvo B19 12. Parvo B19 patient. What do you think? I can tell you, this is one of the touch infections. Cytomegalovirus is one of them. Causes congenital problem. The nurse should avoid it. TB, airborne precaution. Avoid it. In the patient who has TB, this can be very difficult for the baby. Handling what? Chemical agent. These are very toxic to the baby. Administering live vaccine to pregnant client. Administration of the live vaccine is okay, but you cannot get the live vaccine, so this is acceptable. Exposing to what? Ionizing radiation without protection, that is bad. Caring for a neutropenic precaution is a trap. Neutropenic precaution is what? You are protecting the patient, not the patient giving you infection. So if you have infection, you give it to the patient. The patient infection can never come to you. That's the idea of neutropenic precaution. Therefore, the nurse can care for a patient who has who is under neutropenic precaution. So don't get trapped. If you have, I might say that's also okay. We can take care of it. Contact precaution. You wear a gown. Caring for patient with Parvo B19 is another touch infection. Is bad. Congenital problem. So these are conditions the nurse should question and say, no, I cannot take care of this patient because I'm pregnant. The nurse is providing anticipatory guidelines to a client who is what? 10 weeks pregnant. Which instructions should the nurse include regarding nutrition? Select or apply. SATA question on pregnancy question. The same thing we do in SATA and anticipatory guidelines using health promotion regarding pregnancy patient. So what do you teach the patient? 10 weeks. Increase intake of what? Iron-rich foods. take folic acid daily, avoid all fish during pregnancy, increase calcium intake, follow high protein, low carbohydrate diet only. Is that what you want to teach the patient? Did you pick your answer? You stop the video and select your answer. But you have to provide nutrition to pregnant lady. These are common NCLEX questions. They love it. Anticipatory guidelines regarding health promotion. They can trap you. These are straightforward. When you know it, you're very good. This is the area you have to master for the NCLEX. Iron-rich food is good, right? Folic acid is the best thing you can provide to prevent neurotube defect. There's some fish that are okay. Not every fish you should avoid. Fish that contain high mercury or vitamin A, you should avoid it. Therefore, this is wrong. Calcium, nothing wrong with it. Build your bone. And then milk, right? High protein, low carbohydrate diet only, right? You cannot have restricted diets like this, right? This is the extreme. All you eating is protein, no carbohydrate, unacceptable. You are not losing weight. You're building yourself, building your immune system. Therefore, this kind of strict diet is different. Specific diet you should avoid, but you can't say I eat protein and carbohydrate only. That's wrong. Which male should be recommended to a 4 weeks pregnant? So based on that information that we talk about, I build on it and I ask the question, same thing. Now think about it. Select or apply. 4 weeks. What are you going to recommend to the mother? Unpasteurized milk, cold daily meat, peanut butter, and saltfish. Tail fish, what? Baked chicken, hot dogs, fresh vegetables. Peanut butter, orange juice, whole grain, cooked green beans. Fresh fruit, vegetables, rice stew with fried liver. Pasta, rice, spaghetti, fortified cereal. Stop the video. Think about a concept, what pregnant patients should avoid in terms of nutrition, and then use it to answer. When you see a bunch of questions like that, answers like that, they are easy. All you need to do is pick it apart. Find the one wrong answer in all the multiple, and that answer choice is eliminated. So pause the video, select or apply. You don't have to pick everything. If you know one, pick it. There may be only one answer choice there so that you don't mix it. This is the next generation NCLEX select or apply strategy. You pick your answer? I know you picked the right one. Unpasteurized milk, you should avoid it. Listeria. Cold liver meat, listeria, right? Peanut butter is good for what? Folate. Salt fish, too much mercury. Avoid it. So fish, the same thing. Because this is wrong, all of this is wrong. But I'll go through all of them so that you can see. Hot dog, chicken, baked chicken is good. Fresh vegetables, he has to be cooked. Peanut butter is good. Folate. Orange juice, it's just a fruit, right? Whole grain, good. Folate. Cooked beans, folate. Excellent. Fresh fruits and vegetables, no, you should avoid it. Fried liver is vitamin A. It contains too much vitamin A. You should avoid it. Pasta, rice, spaghetti, fortified, these are all good in folate. Therefore, 2 answers there. If you overselect, you cannot get all the answers. But know this, these are straightforward questions. You want to grab it and pick it with you. Easy answers, you should answer them. When you see them in the NCLEX, they're not trapping you. They want you to know these little things. These little things build up your score. Which findings should the nurse instruct the pregnant client to report immediately? Now you're teaching them. When you see something, let me know. Same thing, select or apply. SATA question. I'm building your stamina in terms of SATA question. Don't run away from it. 1 pound weight gain per week. If you teach the patient who is pregnant, said, if you gain 1 pound per week, call your doctor. If you have persistent severe headache, I want you to call your doctor. If you have severe swelling of your face or your hand, I want you to call your doctor. If you have nausea in the morning, I want you to call your doctor. More than 12 fetal kicks in what? 2 hours, I want you to call your doctor. Is that what you're going to teach them? You pick your answer? Excellent. 1 pound weight gain per week, normal. I don't care about it. Severe headache, I'm worried about it. Preeclampsia, swelling of your face and hand, I'm worried about it. Preeclampsia, if you have nausea in the morning expected finding. 12 cakes, I love it. You don't need to call me. And then she's teaching a pregnant what? Client about expected weight gain. They will ask you, how much weight am I supposed to gain? Which teaching point are appropriate? Weight gain depends on your pre-pregnancy BMI. Based on your BMI, we will know what kind of weight you can gain. Excessive weight gain increases risk of complication. Is that true? Weight gain should only occur in the 3rd trimester. Is that appropriate? Gradual weight gain is expected throughout your pregnancy. Calorie intake should double because you need more energy during pregnancy. And you should expect to gain 1.1 to 4.4 pounds in the 1st trimester. Which of this is appropriate? You should include in this teaching. Stop the video, pick your answer. But I can tell you the right answer is what? Think about it. Weight gain depends on pre-pregnancy weight. Your BMI, yeah, that's how we can calculate how much you should gain throughout your pregnancy. If you gain too much weight, you have microsomial baby. You can develop diabetes, risk of complication. Weight gain does not occur only in 3rd trimester. It occurs gradually throughout pregnancy. Calorie intake, you should not double it. Eat whatever you eat, and you should expect to gain 1.1 to 4.4 pounds the 1st trimester. This is all the answers you should need. If you don't know it, I will let you take a picture of it. But stop the video, take a picture of it, master this concept regarding weight gain in pregnancy. Anticipatory guidelines are very, very important. They are straightforward, but if you know it, it's become easy. And if you don't know it, you start to guess. Which statement about exercise? You have to know what to tell the pregnant lady, what they can do with exercise. Moderate exercise is encouraged. Your swimming is safe. You can have contact sports, or you should not. You say contact sports should be avoided. Is that true? Exercise should stop completely in the 3rd trimester. When in 3rd trimester, you have the gravid uterus. There should be no more exercise because it's a problem. Is that true? Yoga may be very beneficial. What do you think? This one is straightforward. It's a bonus one. Everybody needs to exercise, whether you're pregnant or not. If you can swim, yeah, that's a form of exercise. If you can dance, I want you to dance. You should avoid contact sports. It can cause a placenta abruption. You should not stop exercising in the 3rd trimester. And yoga, stress release, is the best thing for you. And then she's teaching a pregnant client ways to reduce infection. How do you reduce infection? Which instructions should the nurse include? Select or apply. This is the same thing in the first question that we saw, but in the different form. You see how they can ask you so many questions? Donate your card for adoption to avoid exposure to cat litter. Is that what you teach the pregnant lady to do to avoid infection? They should wash their hands frequently. They should avoid unpasteurized dairy products. They should eat undercooked meat to increase their iron intake. They should avoid contact with individual who has rubella. What do you think? Which infections control information do you provide to the pregnant lady? Pause the video, pick your answer, and let me know. But I can tell you the right answer is what? Number 1 is B. Washing your hand is good. The next one, unpasteurized milk as listeria, toxoplasmosis, and other things you should avoid it. And then rubella, congenital heart disease. Therefore, you should avoid it in the baby. Avoid taking care of patients like that. Undercooked meat has a bunch of toxoplasmosis and listeria too may be in it. Therefore, avoid it. Even though you can see answers like that, that is partially wrong. Right. It said increase your iron. Well, when you eat meat, you increase your iron, but it's undercooked, and therefore you get infection. You give it to the baby. Now, baby is in trouble. First one is also a trap. Cat litter, you should avoid it. So I said this one to teach you how they will give you an answer choice that is partially right. That is, it's a trap. We call them trap questions and answers. You should avoid exposure to cat litter because it causes problem, toxoplasmosis in the baby. But that does not mean you should donate your cat. Your cat is your friend. Keep your cat, but don't Stay away from the litter. Hire somebody to take care of a cat litters, right? Cat doodles, right? So don't donate your cat. Keep your cat, but away from the cat litter as much as possible. So those are the right answer. This is just to trap you. I change the answers to make it uncomfortable and half of them good. So pay attention. And next is providing anticipatory guidelines regarding what medication used during pregnancy, which instruction are appropriate, select and apply. Take over-the-counter medication as needed. Avoid NSAID unless prescribed. Herbal supplements are safe for healthy pregnancy. Continue prenatal vitamins and increase vitamin A level. Discontinues all prescription medication immediately. There are some answers that are straightforward, common sense, right? Common sense can tell you sometimes the answers you have to say, no, I'm not let them trap me. You cannot discontinue all medication. It can be your blood pressure medication. So is it, or you shouldn't. Prescribed medication should know. You should talk to your doctor. If you take what? Anti-epileptic, seizure medication, they are not good in pregnancy, but you can stop it. You got to talk to your doctor. You should continue prenatal vitamin, yes, but vitamin A causes congenital problems, facial problems in the baby. So this is not good. Herbal supplements are safe for healthy pregnancy. Not, they are not safe. NSAID, you can stop taking it unless it's prescribed, right? Avoid NSAID unless it's prescribed. The setting trimester you should avoid, especially the third trimester, yeah. But first, second trimester is okay, it's safe. So if it's prescribed, take it. If the doctor said it's unsafe, stop it. Over-the-counter medication need instruction with the doctor. You cannot take it. So only one answer there. Over-select, you get 0. Number 9, and then she's providing preconception counseling to a client who has diabetes and a kidney problem, who plan to become pregnant. This is key, combining your concept. When you see questions like that and they give you medical problem, I want you to write it down. If you see a question and they put a medical problem there, that means they want you to focus on the medical problem and avoid any complication to that. She's pregnant, but she has diabetes and kidney problem. You know, when you're pregnant, things can happen to your sugar, right? Which anticipatory guidelines should you include? Tight glycemic control should be achieved before conception. ACE inhibitors should be changed to losartan to protect your kidney. Folic acid supplementation should be initiated. Renal function should be closely monitored during pregnancy. Pregnancy should be delayed until hemoglobin A1C is optimized. What do you think? Pick your answer. Let me know. Test taking strategy, NCLEX practice question, NCLEX review question, maternity nursing question. This is maternity NCLEX questions on pregnancy specifically. I can tell you, we should let your sugar be well controlled, tight control before you get pregnant, because your sugar will go up. You develop insulin resistance during pregnancy. That's why we check for what? Your sugar, to make sure you don't have gestational diabetes. ACE inhibitor, this is the trial answer. ACE inhibitor is contraindicated in what? Pregnancy, but it's protective to your kidney. Therefore, patients who has diabetes need to be on ACE if they have hypertension. But if you change it to losartan, it's still contraindicated in pregnancy. They all causes renal genesis. Therefore, this is a problem. If you change ACE to losartan, it causes you more problem. This is wrong. Folic acid should be initiated for what? Neurotube defect. Renal function should be monitored throughout pregnancy. And your hemoglobin A1C should be optimized. Look at it. Number 1, A and E are saying the same thing. This is test taking strategy. If A is right, then E has to be right, because hemoglobin A1C is optimized, means what? Tight glycemic control. They change the language. You may see that kind of answers in the NCLEX. And the last one, thank you for sticking around. If you like this video, I will link another video on pregnancy anticipatory guidelines. Click on it and these 2 videos to give you all the things you need to know about what? Pregnancy questions regarding pre-conception teaching and what you should expect. Which topics should the nurse include in providing anticipatory guidelines for later pregnancy? Select or apply. What do you want to teach them? What they should focus on? I want to get pregnant. What do I need to know? I need to know about breastfeeding education, child preparation classes, postpartum mood changes, safe sleep practice for the newborn, thorough training techniques for the baby, prenatal, periodontal disease prevention. What do you think? Which one do you think is important? Hey, I got to know how to feed you, breastfeeding, right? I got to know about the baby, classes I need to attend to know. Mood that is going to change is a problem. How I should sleep for me and the baby. Toilet training is later on. It's not preconception. And prenatal, periodontal disease prevention is very important because it gets worse during pregnancy. Thank you for watching. The next video that is coming up will be on the screen. It's anticipatory guidelines. Following this video is part 2 of that. Take care of yourself, and if this video help you master your nursing school, just click on the like button or write a small comment so that the channel can grow. Take care of yourself and good luck. Whichever question that was hard for you, let me know. Take care of yourself and bye.